Thank you, everyone, for joining us for another Learning Lunch hosted by FormatApproved.com. My name is Brian Johnson. I'm the Senior Director of Online Education with Format Approved, and I'll be your moderator today. Today's Learning Lunch will be documentation requirements for ICD-10 require physician education and collaboration. Today's Learning Lunch is brought to you by Athena Health, a leading provider of cloud-based EHR, practice management, and care coordination solutions. To learn more about Athena Health, visit www.athenahealth.com. Be sure to stay tuned for access to a white paper on ICD-10 provided by Athena Health at the end of today's session. We thank Athena Health for their sponsorship of this Learning Lunch. We're joined today by Mike Hodgson of CareerStep, a prestigious provider of online education for the medical community. CareerStep has a proud history of online education for billing and coding, and Mike has a wealth of experience in healthcare, as you can see described on the slide. We think highly of Mike and CareerStep here at Format Approved, so we're especially pleased to share his expertise with you today. Some quick housekeeping notes before we begin. Please note that you can ask questions of our presenter at any time during today's session by entering them into the chat area during the presentation. In the second half of our session, we will address as many questions as time allows. If we do run out of time, answers to all submitted questions will be posted to our website and sent via email link later in the week. Also, note that all registered attendees of today's session will receive an email with links to both the recorded and PDF versions of the event. Folks often ask us if they can get the slides, and rest assured that we'll send those out to you shortly after the event. All right, Mike, let's get right down to it. First of all, thank you for joining us today.
You're welcome. Thanks for having me.
Well, I think this is going to be an interesting session, a lot of interest in ICD-10, and this particular Learning Lunch is going to focus on educating physicians. So let's begin. Maybe the first question may be the most important in some ways, which is that many physicians consider ICD-10 training an inconvenience and they're reluctant to get the training they may need. How can folks overcome that resistance?
Well, I think a couple things is discussing with physicians why we've made the change and how that's going to be affecting their documentation, the coding, and reimbursement. Certainly I-10 aligns very well with the objectives of healthcare reform in improving the quality of care, helping to reduce cost in our system, and it actually has a lot of other benefits directly related to physicians, particularly around reimbursement to their practice. So the ICD-10 education for physicians really is positive for them, and I think that if we just have a ongoing dialogue with the physicians to set the stage for education, it really helps them prepare and embrace that education probably better than they would without that kind of a conversation.
All right, so there's a lot at stake for the physicians in this. What are the specific benefits for them to moving to ICD-10?
Well, specifically more appropriate reimbursement. Most people are aware that we have reached the maximum amount of codes in ICD-9, and so ICD-10 is going to allow us to have a significant more specificity and laterality as it relates to the code sets. And that's going to allow us for more appropriate reimbursement based on the diagnosis and the type of treatment for the patient. It's going to help improve our outcome of indicators. It's going to help us understand across the country the type of procedures that we're doing, diagnosis that we're seeing, the type of treatments and outcomes. It should help reduce the amount of queries. With the specificity and improved documentation, we should have less queries from coders out to the physicians, which will be an advantage to the physicians. We should have less compliance issues by having more detail in our code sets and documentation. That will really help with compliance, which leads into reducing claim denials and approval of RAC claim review. That's been a hot topic across the country over the last couple years, and being able to improve that claim review is really important to the healthcare community. We will perceive to have more clinical and accurate clinical data, which will be important for us, which will help advance disease protocols and clinical pathways.
Now, just in case anyone in the audience isn't familiar with the term, tell us just a little bit more about RAC claim review.
Well, RAC has been a new process that's been required by the government, and it is detailed review of claims and scrubbing of claims. And so what's happened is that as the RAC review has happened, the physicians and the hospitals have had to do a lot more work in providing documentation, more detailed documentation. It was in preparation for ICD-10. So it's caused a lot of extra work within the hospital and physician area. And so one of the goals is that with RAC continuing, we want to make sure that we're utilizing ICD-10 to help improve that claim review, which will mean less inquiries back to the hospitals and physicians, and also less time that they'll have to spend to follow up on that.
All right, thank you. So I guess a lot of the concern here is how to get physicians to really engage with the training. So tell us, how can training be structured in a way that meets the physician's needs but doesn't, impose a burden on them that distracts them from providing patient care?
Right. Well, I think a couple things is that one of the things that we want to prepare physicians for is the new levels of specificity. And what I mean by that is that if we have good documentation up front, it's going to allow for those codes to be selected properly and, again, have less inquiries back to the physicians. But more importantly, it's going to help us start documenting the type of patient encounters that physicians and the providers are having, the outcomes, and help to ensure good financial workflows. One of the big concerns that people have around ICD-10 is we know we're going to lose productivity at the coder level. Canada saw a 50% reduction in productivity. And so if we can get proper education up front and help reduce the amount of productivity loss that we're going to have, that is going to not just help the processing of claims, but really making sure that the financial flow back to the institutions and physicians are consistent and that we don't have any financial gaps. And so when physicians understand their role in that, it really helps solidify for them why they need education. And I think it really has brought down a lot of barriers in the conversations we've had with physicians and with our clients.
So what else should the training for physicians achieve?
Well, a couple things. One is we want to make sure that we're addressing physicians by their specialties. We know that the time that we have for education is limited in the physician arena, and we want to make sure that we're providing information that's relevant to them, and that will allow us to streamline the education. We want to make sure that we clearly identify the differences between 9 and 10, and I really don't mean specific code sets, but how the codes are structured, because if we understand that, then the need for documentation becomes much clearer for the physicians. So without understanding that structure, trying to communicate or educate to the physicians why they need to do this certain kind of documentation, it get lost in that transition. And we want to make sure that that they understand that the advantage that they have is not only to them financially and to the facilities financially, but we want to decrease the amount of queries that have to reach out to the physician. It delays reimbursement, and it just ties up a lot of staff time, both on the physician side and on the provider side.
Right, so getting it right, there's quite a bit of incentive for them to learn the system and really get over that initial hurdle for the transition, but then it should ultimately save them time. Certainly, it's in their best interest to learn about how the code works. It seems like what you're saying here is that they really need to focus on the areas that are, most important to getting that documentation right.
That's correct. And in that area, Brian, there's really two parts that is going to be critical. There's what I call the general education, and I don't mean general as in non-specialty related, but there's only so much information that can be departed to the general population of physicians. Each provider is going to have to do their own internal documentation review to provide extra education, because what one facility's struggle is with documentation with total hips is different than another facility's. So it's going to be really important that providers are providing that documentation review and augmenting any education that they provide from a vendor out in the field with their own specific documentation review and detail back to the physicians.
That's an important point. So you know physicians well, and you've worked with physicians in their training. What approach do you recommend for them? What's going to work best?
Well, we've developed our programs to in a very modular approach so that we can provide general education to all physicians, so that the general understanding of not just why is ICD-10 important, but the difference between the 7 characters versus 5, how is that going to affect them, and then break training down by specialty with diagnosis, and then another program by specialty for inpatient procedures. And that allows us to direct the education specifically to the physicians in their specialty and in diagnosis and in inpatient. We also believe that the training needs to be concise. It needs to be short and to the point. We are an online provider, and we certainly believe in that model. But having an online self-paced program and accessible online allows the physicians to access that anywhere, any place, whether that be from their laptop at home or their mobile device. We also think some of the education that we in the industry are calling physician education, we think the physicians are going to ask some of their staff to take that, whether there be their clinical nurse that is working with them or an office manager. So having this as a online education is going to accommodate, we think, a lot of different people's needs. And it's also going to help us specifically address gaps in documentation that we have between 9 and 10. And having the physicians understand how that documentation in their specialty is going to improve the correct code selection is going to be critically important in the training.
Well, we certainly agree with you that the future of online learning is really the way to go, because it's amazing to me that people still are going to boot camps for various things, and that has its place, I suppose, but it really seems to us that the future of education for physicians and many other providers is online.
We certainly believe that, but if you look at what's been happening, over the last 10 years, and particularly the last few years, as physicians are in the facilities less and less. They don't have to be on the floors to provide the information for the charts. The electronic health and electronic medical record has driven things to be online, and so it is really important that you're able to provide the education to your learners where they're at, and not require that they come into facilities.
So you've sort of alluded to the fact that this transition, it's not just about physicians learning some things, it's also about the facility itself, becoming accommodated to this new approach. So it's kind of an all-hands-on-deck situation. Tell us a little bit more about how practices and facilities can plan to make their training effective and kind of close that gap that you're talking about.
Well, a couple different things is we certainly believe that before any training starts, it's really important for facilities or providers or physician practices to develop a internal ICD-10 team. No matter how big or how small your practice or facility may be, because the code sets affect much more than billing. For example, reporting. You have to make sure that the reports that you're generating in any system accommodating I-9 can accommodate I-10 codes, and that means your IT team or your IT outsource vendor need to be involved in that conversation to prepare for the different code structure. You also need to make sure that people who are doing any data analytics or reviewing financial data is involved in those conversations. So having a team across the board really helps you make sure that you're covering all your bases. You want to make sure that you're accessing physician documentation and identifying the key areas of risk. You want to understand where are we weak in our documentation, where are our top procedures and diagnosis, and focus in on those areas. And you need to plan on providing time for your chart and documentation review. And that occurs both at the facility and at the practices. And you want to review how your coders are currently being used in your practice. So whether that be as a coder biller is off-site, don't take for granted that your off-site or outsourced coder and biller is being educated and that you shouldn't be involved in that. Ask your outside vendor, how are the coders and billers being educated? What can you do in your practice to help prepare them as they need to outreach to you? So be engaged in all aspects and make sure that you know your key diagnosis and your frequent codes that you're used today, and outreach to the coders and to your facilities and or your outsourced vendors. How can you start looking at the translation of those codes to ICD-10? How can you be preparing for those?
All right, and before we move on, I just want to remind our audience, we've already got some questions. We'd love to take your questions now. We're going to hold those for the end of our session for Mike to answer. But if you do have questions as we proceed, please go ahead and type those into your chat area, and we'll be sure to pass those on to Mike at the end. So, Mike, let's go on. What are other steps that are involved in effective training?
Well, we talked about some of these that are already on the screen, but I want to say again, I think one of the pieces that a lot of people are still struggling with or are waiting for is having somebody else come and tell them exactly all the things they should be doing. And I think it's important for practices to get engaged now and understand, for example, look at your I-9 codes now and reach out to vendors or reach out to your educator or your facilities and find out how can you translate those into ICD-10 codes. And when you understand that, it's going to start making sense to the type of documentation changes that are going to be required. Let's not wait until somebody comes in and tells you, here's the new drop-down menu you need to select from. Be involved and engaged yourself. Engage your staff on protocols in your practice that are going to be important for them to understand. We are updating to contemporary language from I-10. So just knowing the key medical terms that are changing in your practice and making sure that your staff knows what those are will really help in all the documentation that's done outside of what the physician does. And then you want to look at what ongoing support and guidance does your staff need after initial training and after rollout. Most of my clients today are looking past October 2014 and starting to think about what do I need to do in 2015 and 2016 to make sure that we're continuing to support the new staff that may come into your practice or the staff that's currently there, so that as you start to struggle in certain areas, you're prepared to provide additional education or resources to your team.
That's a great point. So it's not as if you get to October 2014 and you've crossed the finish line and you can just forget the whole thing. There's going to be ongoing training and accommodation that's going to have to be made.
Exactly. And what I talk to my clients about, and I've been in the healthcare vendor side for over 28 years, so I was around pre-DRGs, and if you stop and think about it, since DRGs, we have never had to self-educate ourselves as a healthcare community to any extent like this. So this is not a one-time event or a one program for CEUs. This is going to be an ongoing educational need past 2014 for you to have a strong, effective practice, and you should be thinking about that and budgeting for that past that October 2014 date.
So I really like this question because I hear this a lot. What's one of the largest misconceptions about physician training for ICD-10?
The number one is the number one on the screen here is that there's a belief that it means that physicians need to learn new codes. They don't need to learn new codes. They need to understand how the codes are structured at a high level and how that's going to affect documentation. And in a lot of places in the ICD-10 CM side, on the diagnosis side, many things haven't changed. So it's really understanding what are the things that have changed, what do I need to do and my staff needs to do around documentation, so that I can effectively have the correct codes and the correct billing to go out the door the first time. And really in I-10 there are far fewer unique documentation concepts as it relates to ICD-10 CM. So understanding by your specialty what those changes are will really help you better prepare for that documentation changes that you need to be providing.
Yeah, that really seems to me to be one of the central points here, because we hear all the time, oh, there's more than 67,000 codes in ICD-10, and so there's a lot of concern about that, and obviously people are right to be a little concerned about the change. But the real change that physicians need to think about is the reason why there's so many codes is because of how the coding set has changed in terms of the information that's recorded, and that's really where they need to be focused. So I just really think this point can't be emphasized enough.
Yeah, I agree with you, Brian, because the amount of codes really drives to that specificity. And so having, for example, we have 3 levels of persistent asthma. That just means that we need to document right, so that we can track that diagnosis, we can track the treatment by the patients, and we can have much better data about outcomes in the healthcare system than we have today.
So you've talked about the fact that they need to understand these high-level changes. What are those changes that physicians need to understand?
Well, I think as they start to go through the education in their specialty, some of the key areas that are going to be important for them is site. And what I mean by that is from an inpatient procedure standpoint or even diagnosis, what more specificity or laterality as it relates to the procedural site. It's going to be important for them to understand the timing of documentation. And not just the timeliness of it, but if you think about when you're having follow-up visits from your inpatient procedures and the patient's coming back into your office, the timing of that is going to be critical, and you're also going to make sure that you have to understand the different stages as it relates to your diagnosis and to your procedures. The other piece that is going to be important for them to understand in the general education is drug, alcohol, and tobacco dependence. It's really important that we document that properly so that we can tie any of these dependencies or long-term use of prescription drugs to potentially the type of diagnosis and procedures we're doing. And so that's something that's going to be discussed with the physicians, and that is not necessarily new, but it certainly is a different requirement as it relates to code sets.
And when it comes to the laterality, what we're talking about here is, under ICD-10, it's not just a question of, you have a problem with your ear. It actually gets down, you actually have 2 ears, and so the coding is able to specify which of your ears or whatever organ it is, which is involved in the condition. Is that correct?
That is correct. That's absolutely correct. And in many times what the physician's going to find is they're already doing that documentation. And so this is the time where they're able to learn, okay, well, I'm already helping in that area. I'm already providing that, but I'm missing this one piece. And I think when the physicians see that, particularly by specialty, they're going to realize, I think in a lot of cases, there isn't a lot they have to change, but it's certain things by adding just some detail will provide a lot of benefit in securing the correct code, which in essence means securing the right reimbursement.
So you talked before about assembling the team and planning out the process, but apart from those things, what do people need to do to get started on this?
Well, you definitely should be trying to find your training partners right now and identifying which pieces of the training that you would like an outsourced vendor or a partner to provide versus what is the training that you need to do internally. And you really should be looking to, right now, between now and the end of the year, reaching out to those vendors. And you want to make sure that whoever you're selecting has the tools to meet your specific needs, to make sure that they're able to address the specialties and to address this from a modular standpoint, from diagnosis and from a inpatient procedure style. You also want to make sure that you understand the different ways that your physicians are going to need to access this training. Do they use laptops? Do they use mobile devices? Which mobile devices? As I think we all know, any Apple user knows that there's times where we can't watch videos from our streaming service because it isn't able to be compatible with that Apple device. So don't just assume that when somebody says we can access it via a mobile device. You need to get down into the specifics. You don't want to find out at the end your physicians can't access the training because we didn't ask enough questions. And then internally, everyone needs to take responsibility in reviewing the current documentation and comparing that to what is the documentation that you need for I-10. And if you don't have the internal staff to do that, reach out to somebody, whether that be your facility that might be able to help, or an outside consultant that can come in and help you identify the differences between 9 and 10 and where your gaps are.
So what's your biggest concern then about ICD-10 readiness? There's still a long time to go, but where do you think there's potential for trouble?
Well, the piece that I think people aren't looking at is looking at that timeline past October 2014 and starting to put all the pieces in play. So, for example, the ICD-10 education to physician is just one of the components. Another component is going to be your EHR, EMR template changes. How is that going to happen? When do you want to time your training in relation to the general education training, to specialty, to your EHR or EMR training? Are you going to be introducing any new systems in play that physicians need to be aware of, whether that be a new billing system that's going to require additional education, and what staff outside of physicians in the practices need to be trained. So when we've worked with our clients, we've looked at diagramming a project plan through 2014, and when you start identifying all those steps, it's much easier to put in play when training should start. I think some folks right now are struggling is they get to the first step and they get done with step one and they're like, okay, what do I do next? You want to identify all of those steps in relation to that. The other piece is we have seen from surveys that have been done by several organizations that are identified here on the screen is that there is still a fairly large percentage of providers and physicians that have not started to prepare for that, which means vendor selection, identifying what you need. So we still see that there is a great need in identifying what the facilities and physicians need for training and putting together that action plan. So I think that we have the time, and between now and the end of the year, we certainly have enough time to identify all of those steps and seek out the resources that we need, but we need to make sure that we're doing that prior to 2014, which is just a few months away.
And you have here a number of surveys from prestigious organizations such as HEMA and MGMA really showing us the lay of the land, which is that people aren't ready at this point. They certainly are not ready. And so really the preparation and the planning that you're talking about is critical if people are going to be able to be prepared in time and then continue to meet their, overcome these obstacles after that deadline.
Yes, and I think that You know, I look at it and I talk to my clients and departments within facilities or physician practices. You know, I continue to say, don't wait for somebody to come to you and say, here is a plan. Start reaching out, start, you know, owning that, because it's going to be you're going to have a lot more success if you're participating in that and embracing it and helping to plan for that versus waiting for somebody else to come to tell you exactly what you need.
So what advice do you have then for providers who are looking for ICD-10 training for physicians?
Well, as we talked about, make sure that you have a modular approach that you can address by role or specialty. The last thing that you want to do is to provide education to a physician for them to look at the education and go, this doesn't relate to what I do every day. So you want to have that training specifically geared to the physicians. And some of it will be complicated. You know, we have new roles across healthcare. Hospitalist is a great example. The education that a hospitalist needs is a much broader type of education than specifically for a specialty surgeon. So it is really important that you understand all of the type of staff that you have that need to go through the training, and then make sure that as you're talking to your vendors or you're building your own programs, you're addressing that by specialty. We firmly believe online and self-paced. You want the ability for the physician and your learners to be able to, at any time, when they have the time, to access that program. And we believe that these programs are going to be accessed more than once. We're going to have a wave of training, and then there'll be EHR training or new system training, and people will want to go back and look at the training again. So having it online and self-paced is going to be really key, we believe.
So a lot of those elements are really, you know, if you want physician buy-in, meet the physician where they are. You know, give them the information they need, make it convenient, and then, you know, you'll get the buy-in from them to get that training.
Absolutely, absolutely.
Well, please continue.
No, that's fine. And I think that, you know, think about, as I mentioned before, your EHR or EMR templates and the prompts. Those are the type of things that is going to be important to take into consideration in your training, and make sure that you know, based off of the type of patients that your physicians are seeing or your practice is seeing, make sure that you're focusing on that education. And one of the things that we pointed out is it's not just education in your specialty, but what are the underlying diagnoses that you typically see all the time? Do you have a practice that has a high rate of diabetes along with the type of patients that you're seeing? Or do you have a lot of cancer patients that are coming in? So think about the underlying diagnosis, not just your specialty. And I think when you start breaking that information out, it's going to be easier for you to look at, well, you know what, this isn't a lot for me to consume, but now I know exactly what I should be trying to reach out to my vendor to ask for the type of education that I need.
All right. Well, we have plenty of time for questions from our audience. We already have some, but I want to encourage everyone who's on the line to go ahead and ask questions. This is a rare opportunity to ask any questions you may have about physician training for ICD-10, so please go ahead and share those with our presenter, and we will pass them on to him. But let's start with our first one here. All right. And this sort of dovetails nicely with what you were just talking about. What are your thoughts, rather, on the effectiveness of the existing EMR system a practice uses in making this transition? The question goes on, many offices feel that the EMR system will handle most of the training, transition, and coding moving forward.
Well, I think that that is not necessarily a misconception, but certainly the EMRs are going to, whoever's working on your ENR and providing those template changes, is that those template changes are going to be made, but if the physicians don't understand why is it important for me to select additional codes or additional documentation, So again, the training that we've been talking about is not really educating on the specific codes, but why are the documentation needs important to affect the codes. So what we've seen is that the facilities that have already gone through physician training and then EHR training, physicians have come back to us and said, the EHR or EMR template training is much easier for me because now I'm understanding why instead of having 2 things to select, I have to select between 10 things. So that training that they needed to have on with EMR was significantly reduced by them understanding the code sets.
So the EMR companies, that in terms of the technical aspects of it, they're updating their products at this point. So that's something that, you know, a practice, I assume that they need to coordinate with their vendor on making sure that all of that is taken care of, but it shouldn't be a problem, presumably.
That's correct, and I think that everyone needs to be talking to their vendor about the template changes. Don't assume that there's an automated process for that template change. Because of the amount of codes that are going to be in place and the specificity that's going to be related, engage your vendor, know what that template changes are going to be, ask the questions ahead of time. Do not assume that all the vendors are going to be able to make all template changes and that there won't be anything that you have to be involved with. You know, engage in your vendor now, understand what they are going to be doing and what you're going to be required to do to help with those template changes.
So the coding set will be available in the system, that much is certain, but people shouldn't presume that their workflow and the way that they actually work in the system, that's just going to be taken care of for them by the EHR vendor.
That's correct, and if you stop and think about it, think about when the EMR was implemented in your practice. The EMR just didn't drop in via software and you turn it on one day and have a day of training. There was a lot of setup that had to be done for your practice that was in essence driven by the type of patients you saw, both for your specialty and by your underlying conditions. Maybe you have different types of patients than you did 2 years ago when you implemented the EMR. So the same type of questions that had to be asked to get to where you are today are going to need to be asked about ICD-10. So engage the vendor and do not assume that they have all the information to update your system without you participating.
And we have heard some people talk about the possibility of the EMR companies actually coming in and training people, but I think that that is mostly a matter of hopeful thinking or wishful thinking. They're not going to solve your ICD-10 problems for you, obviously.
That is correct. We do not have, when I say we, the collective healthcare community, we do not have enough feet on the street to provide seat training for every facility, for every practice. So you can't rely to think that somebody's going to walk in and be able to help you in a 1 or 2 day setting. You need to be asking your vendors now, what can I do to prepare? What information do you need? And also think about the fact that there should be some, not just training time, but you should run through some scenarios in your top diagnosis and run through the ICD-10 template and go ahead and fill it out and see what the outcome is. It's going to be, what you don't want to be in a position is to find out that you didn't quite understand the template after you've started to use it, because that's going to be that you've had a claim denial and that you've had to relook at that and redo and research. So the more you can understand up front and how you can get that right is going to be a huge benefit for you when that switch is turned and the bills start going out with ICD-10 and the claims have to be reviewed by the payers.
Are there other vendors that providers need to keep in mind around this transition?
Well, I talked a little bit about this, but your billing system has to accommodate these new codes and the code structure. So if you have the billing is outsourced through a vendor, whether that be a regional or local person that's helping you or a national company, reach out to them and ask, what is it that you need from me to make sure that when you provide the billing, that it's going to be correct and that we're not going to have a lot of denials. What information do you need to be getting from me right now so that the billing portion can be successful? Reach out to the person. Don't assume that they're going to have all the answers because they have to go through their own training. They have to be understanding what the payers are doing. And the other thing is reach out to your payers. Ask them if there's information that they have that would help your practice to be more efficient in how billing is done. The payers have been probably 18 to 24 months ahead of providers and physicians in looking at ICD-10. So you can count on the fact that the payers have been looking at I-9 claims and comparing it to I-10. They have a lot of information already. So don't be afraid to reach out and ask them, what can you tell me as it relates to my practice that would benefit so that I have a clean bill and we have clean claims.
That's a great suggestion. Actually, and that generated a question. I'm going to skip ahead to this one because while we're on the topic, the question is, will the payers be providing any testing tools where ICD-10 codes can be submitted to test that they are complete compared to the ICD-9?
That's a great question. Some of them have. I think right now the healthcare facilities are probably in a better position to be able to reach out to those payers, and what I mean by that is that the payers don't have the ability, for what we've seen so far, is to reach out to every individual practice. And so they've been working with the facilities right now. So again, I think reaching out to your payer and asking them that question, we've seen from a payer standpoint that what they're preparing to do is to providing facilities in a written format or in an online format the things that they should be doing to prepare for that, and sort of the good news, bad news list as to what practices should be prepared for. So you really need to reach out to your payers, and it is a broad spectrum. Some payers have been very aggressive in providing that information. Some are still working on that.
Here's another question from our audience. Do some specialties have more to learn than others? In other words, are there some specialties that should really be on the lookout because they're, everything's going to be different for them, or is it pretty consistent?
I think that it's pretty consistent across the board. I think the specialties that are going to need more education are related to the types of patients. Again, a hospitalist is a great example. The hospitalists have to touch patients with a much broader range than somebody that is a orthopedic surgeon that is doing total hips and specializing in that arena. But for the most part, as it relates to specialties, the education is going to be, lengthwise, is going to be relatively the same. The detail won't be the same. For example, there are some practices that as they see surgical patients that come back, they're going to have to understand the 7th digit of the code and how that relates to documentation. There'll be other specialties that the 7th digit doesn't even really relate to, and that's a type of information that you'll have during the training.
You mentioned before that one of the big changes has to do with alcohol, drug, and tobacco dependence. Could you tell us a little bit more about why that's different or how it's going to affect documentation?
Well, one of the things that we're trying to do is to not just understand the diagnosis, but what may have caused that diagnosis. And being able to identify dependencies is going to be important for us to take a look at that data. So are there dependencies that we have that are driving certain types of cancer? Are there dependencies that are driving diabetes? And it's going to be important that as physicians we're asking the right questions and engaging our patients so that we're providing that level of detail. And again, it's also pharmaceuticals. and the importance of, as you're noting, the type of pharmaceuticals that are being prescribed. Is this a pharmaceutical that is being used consistently? Is this a drug that's consistently being used by the patient, so that there could be some long-term effects, or was this just a short-term need for the patient? So dependency isn't necessarily always related to the worst form of dependency, but dependency can come in a variety of different ranges, and the use of these type of products are going to be important for us to understand as it relates to the diagnosis and getting that clinical data across the country.
Well, that really connects back to one of the points of the transition to ICD-10. There's a lot of different elements involved, and you've mentioned some of them, such as improved reimbursement and that sort of thing. But there's also this whole aspect of it that's about improving healthcare overall. You've got all of this improved data collection in these codes.
Absolutely. And I think one of the, you asked before some misconceptions, and something that wasn't on the slide and I didn't talk about is that, one of the biggest things that I've heard is, well, this is just government intervention. They're just making us required to put more information down, and why do we need all of this information? And if we stop and think about it, that if we can figure out how to control our healthcare costs better, and that means what is causing the diagnosis and how can we change what we're doing in our lifestyle, that's the way we're going to get our healthcare costs under control. There's only so much we can do without that kind of information. And so when we stop to understand that this additional documentation and the additional codes are going to provide us with significantly more data, and think about how that's going to help us 5 years, 10 years down the road, how that's going to help our children, our grandchildren, and how they can access healthcare. That's really what this is going to be about, and I think it's important for us to take that step back and look at the bigger picture and not just, oh my gosh, look at everything else I have to do, to affect ICD-10.
So here's a question that may sort of address the boogeyman standing in the corner. So I'll just read it here, because I'm sure it's on a lot of people's minds. Do you anticipate a period of reimbursement rejections? How do people need to plan in terms of cash flow?
That's a great question. I'm not sure that I'm the best person to recommend sort of a reserve from a cash flow. It is certainly something that you should be talking to your financial team about. And I think that the best way for you to help plan for this is to make sure that you understand the type of patients you're seeing, understand the underlying conditions, and looking at your current denials and reaching out, to your payer and asking for their assistance in helping provide information as to what they need to make sure that claims aren't denied. If you're seeing a lot of patients that have diabetes, ask your payer, what's the critical information that I'm going to need to have to meet that kind of patient population? And I think that you'll find that a lot of the payers have this information. Again, they've been scrubbing this data 18, 24 months ahead of the rest of the community. So don't be bashful in asking that information. It may take 2 or 3 knocks on the door, but if you can get that information, that's the kind of information that's going to help you reduce the amount of denials.
And so I think for many practices, this, smaller practices, this may be a concern because they, being smaller operations, they may not have as much cushion when it comes to cash flow. But it sounds like you're saying if they just really focus on what they actually document and how this is going to work for them with just a modest amount of preparation, they shouldn't face the sort of apocalyptic, confusion around reimbursement that I think some people are fearing.
I think you're absolutely right. And again, I know I keep repeating the same piece, but I think that if people would stop and think about it, when was the last time that you've really done a review of your patients over the last year and looked at the diagnosis that you've given, look at your underlying conditions. That kind of review and information and sort of self-assessment of what my practice is today will give you clearly, okay, now I understand the areas that I need to be concerned with. If I don't see a lot of patients with cancer, then I should focus on the other underlying conditions. And I think if you do that homework, you're going to look at it and say, oh, I don't have this huge hill to tackle, but I now know where I should focus my attention on.
Well, and that's one of the points of relief I think people should take away from this is that, you know, for the coders, they probably need that comprehensive knowledge of ICD-10, but for physicians, that's really not necessary for them.
That is correct. They really need to understand the key documentation changes. The codes will be handled by the coders and the billers, and if you're providing them with the right information, you don't need to understand the code number, the alpha and the digit. You just need to understand the type of information that I need to be able to provide.
All right, here we have a question around timing. The question is, has there been a complete resolution as to whether you use ICD-9 or ICD-10 codes around the time of the transition date? And can you clarify how that's going to work, especially when there is a resubmit after initially using ICD-9 codes?
That is a great question, and there is no hard rule as it relates to that. You need to reach out to your payers and ask them that question and how they're going to handle that. And so the payers have some control over that, although there certainly is a deadline that's imposed by the government, sort of the rules of the road of, well, if there's a resubmit, how do we handle this? So really the payers should be able to provide you with that guidance and look for them for that guidance.
Well, Mike, I think we have time for maybe just one more quick question, although maybe this question is too large, and I think you've addressed it to some extent. But the question is, what would you say to doctors who want to throw up their hands because there's so many changes coming to healthcare all at once? I mean, just off the top of my head, I can think, 2014, you've got Stage 2 of meaningful use, ICD-10, the Affordable Care Act is coming in. What would you say to those folks who are frustrated at all of these changes?
Well, I could certainly understand the frustration, and I really do believe that if you're able to look at your practice, the type of patients that you're seeing, it's going to be easier for you to focus on the areas of education and understanding that you need to have in all of these different arenas. And I think that if we're standing there waiting for the worst or throwing up our hands, I think that's going to create a lot of challenges. And I really do think that if you can sort of dissect your practice down a little bit, understand your patients, and then go out to these arenas of educators on ICD-10, go to your payers, you'll be able to ask the specific questions. So it's going to be a lot easier for your payer to answer your questions if you know your type of demographics that you have. And so self-evaluation of what is my practice, what are the type of patients I'm seeing, will help you limit where you really need to go for your education.
Well, because we have limited time, we're going to assemble all of those questions from our audience and post the answers on our site with links delivered via email later in the week. So be sure to watch for answers to your questions if we didn't get to you today. I want to thank you, Mike, for joining us for today's Learning Lunch. It was a very informative session. I really enjoyed it. To learn more about our industry expert, Mike Hodgson, and CareerStep, including the company's ICD-10 training, please visit www.careerstep.com. Mike, maybe you could just say a few words about the training that you offer at CareerStep.
Sure, absolutely. We provide training not only for physicians but also for coders and billers. And again, we do that by specialty and by a very modular approach. So there are a variety of different programs that we have. We also have general education or awareness programs, so that if you're at a large practice and you have an internal IT team and you need to provide information for them about code structure but not really opening up a code book, we have several different programs that are applicable for what I would say the non-clinician or non-coder for staff that need to be educated at different kinds of levels.
So I would encourage folks to visit CareerStep's website. They've really got some great programs that would be helpful for you. So please take advantage of that opportunity.
Yeah,
so
and if you go to our website and you click on the CareerStep, or you go to CareerStep, you'll see the home page, and just click on corporate training, and that will provide you a link to all of the ICD-10 training that would be applicable for your practice or your facility.
All right. Well, thank you, Mike. Thank you very much for joining us.
Perfect. I appreciate your time, Brian, and good luck, everyone, on this transition.
All right. Well, just a few more notes for our audience. I'd like to thank all of our attendees. Remember that all registered attendees of this event will receive an email with links to both recorded and PDF versions of the session. For comprehensive training in meaningful use, register for ForMed Approved's new Certified Meaningful Use Professional course. The course covers the requirements for both Stage 1 and Stage 2 of meaningful use for both eligible professionals and eligible hospitals. Visit www.formedapprove.com/education/courses_CMUP.html to register for that course. You can see the URL on the previous slide when we send out the slides to you if you're interested. You can learn more about our other training offerings at formedtraining.com. Again, today's Learning Lunch is brought to you by Athena Health, a leading provider of cloud-based EHR, practice management, and care coordination solutions. Begin your preparation for ICD-10 today with a free resource provided by Athena Health. This brief white paper provides a wealth of planning advice and estimates the potential impact on cash flow. Be confident in a successful transition by reading ICD-10, preparing your practice for the big changeover. You can see the URL on your screen. Visit www.formedapprove.com/PDF/ICD-10 preparingyourpractice.pdf. Be sure to include the underscores there. To learn more about Athena Health, visit www.athenahealth.com. Again, we thank them for their sponsorship of this Learning Lunch today. Visit formedapprove.com to learn more about our upcoming Learning Lunches. The Learning Lunch button will take you to our entire slate of upcoming webinars. Our next Learning Lunch will air on September 18th, that's tomorrow, and will cover the subject of deadline looming for HIPAA compliance. Are you ready? There's just a week remaining before the omnibus deadline, so the time to act is, well, the time to act was probably 6 months ago, but there's no time to lose. So be sure to tune in to hear from our expert, Mike Simmel. Keep an eye on your email box and our homepage for other upcoming topics, and thank you again for joining us today.